Okay, this video is going to be Introduction to Cancer, Intro to Cancer. I'm going to go over an overview. I had a lot of people asking about cancer lately. By the way, I have tons more video on cancer. I've got an entire playlist of videos on cancer. I wrote a book, Poor Man's Way to Fight Cancer. So that's all going to have far more detail than what I'm telling you here. But this lecture is going to give you all the key points so that when you talk about cancer, you'll have the big picture in mind that'll help you to understand things better. So this is a diagram of the lymph node areas in the neck. The reason I'm showing it to you is that the older a person gets, the smaller their lymph nodes shrink down, the weaker their immune system gets. So that's why it's part of, as you get older, smart to keep improving all your health habits to compensate for the fact that you're getting older so that you'll stay healthier. Okay, so the lymph nodes will shrink, and what I mean by that, that's highly relevant to me. By the way, I've done thousands and thousands of biopsies. And I do tons of neck biopsies of lymph nodes. So I'm very used to all this stuff. And a lot of times they made the initial lymph node criteria based on old people. And then I would get sent to all these patients who got CAT scans and MRIs of lymph nodes that meet criteria for biopsy. But because they're young, it's normal. So it does depend on the patient's age. All right, so now I'm going to, and by the way, all these lymph nodes kind of start up here around the mouth because the food you eat and the air you breathe in is how bacteria get into your mouth, and then they're processed up there around your tonsils and your tongue and everything, and then they come down through your neck lymph nodes where the lymph node immune cells work with them, and then they drain into the venous system. Okay, plus you got tons of lymph nodes all around your intestinal tract. Okay, but that's an important point. The lymph nodes shrink as you get older, and that makes you more vulnerable to cancer. Okay, a typical thing I look at this sort of thing every day. Somebody will send me a case and say, look, these lymph nodes are big. Do you think they need to be biopsied? Technically, do you think you can biopsy? And I got to plan a route, got to avoid the carotid artery, got to avoid the jugular vein, got to, avoid the bone. I don't want to have to drill through the bone. So those are the kind of questions I deal with on a routine basis just about every day. Okay, and then all the lymph nodes have a name based on their location. So this is a typical thing I'll deal with. And now I'm going to show you some theories of cancer. Now, when you talk to people who don't know anything, they're going to tell you, oh, what do you need a theory for? But if you talk to an intelligent person, you always want these theories. And you want to try to figure out, what am I dealing with? And what are my options to treat it? Okay, so this is from a Dr. McDougall lecture where he was talking about dietary implications for lymphoma. And he was referring to a theory by a doctor by the name of Cunningham. So here it is, Alan Cunningham's paper from about 1975, 1977. And he came to the conclusion that lymphomas seem a lot more common. So a lymphoma is a cancer of the lymph nodes. Okay, he felt they were a lot more common in people who eat animal foods because that was causing this hyperactivity of the immune system, and then it would get out of control, lose regulation of itself, and become a lymph node. By the way, there's 4 major categories of cancer. Number 1, and you want to know this, number 1 is carcinoma. Okay, so carcinoma. Carcinoma implies of an epithelial surface, like the lining of the esophagus or the colon, for example. All right, or the bile duct, cholangiocarcinoma. So that's carcinoma. Number 2 is sarcoma, and that's like deep tissues, like a sarcoma is a tumor of the bone, for example, okay? Number 3 is like lymphomas. That's also a solid tumor. Number 4 would be melanoma. Those are the 4 basic categories of solid tumors. So solid tumor means you could touch it, you could feel it, it forms a mass. And then there's what you would call liquid tumors, and those are things like a leukemia, okay? An elevated number of white blood cells proliferating out of control. And you can detect that in the blood by doing a blood draw, okay? Okay, but this is an important point. Older people, excessive meat consumption associated with increased risk of lymphoma, thought due to chronic overactivation of the immune system. Because there's more inflammation related to eating animal foods, all right? T. Colin Campbell in his book wrote that was the number 1 cause of cancer was the increased carcinogenicity, cancer-causing effects of eating a lot of animal foods. All right, now I want to show you this right here. This is from this dentist, Hal Huggins, probably the greatest dentist who ever lived. And he saw some leukemias in young people that he thought were related to dental infections, okay? And he felt that what was happening is they were having a hyperreactive response, things like leukemias, due to a tooth problem. So the point is, they saw a bunch of patients, if they took out the infected tooth or the filled tooth or whatever it was, the patient got better. So if I had a kid with a leukemia, I would do that. What have you got to lose? So talk about a risk-benefit ratio, a lot to gain, not much to lose. All right, so just be aware of that. Okay, so now I'm going to show you something, and again, the first time I learned this, it was from Dr. McDougall. Okay, McDougall is a smart old guy. I'm telling you, that guy's an old genius, all right? And here is, let me see if I can get this thing to work here. I want to show you the picture here. So here's the point of it. You start out with one cancer cell, and then the cancer cell has to double. Typical doubling time for a cancer, let's say it's a rabbit, meaning an intermediate rate of growth cancer. It's going to double in about 100 days. So one cell becomes 2 cells. Then another 100 days go by, 2 cells become 4 cells. And it keeps on doubling each 100 days until it becomes about 1 centimeter in diameter. 1 centimeter in diameter is key to know because usually you can't diagnose a cancer until it's at least 1 centimeter big in size. Okay, you're not going to be able to see it on a CAT scan. It's going to, it's going to blend in with the background noise and scar tissue until typically it gets to be about 1 centimeter or more. You might even see it when it's less than 1 centimeter, but you can't confirm it's cancer. Okay, and the importance of this is to realize that, same thing on a PET scan. You're not going to see stuff on a PET scan typically until it's usually about 10 millimeters or more in size. Okay, what's the relevance? Well, by the time it's 10 millimeters in size, most of the time it will have shed some metastatic cells to other locations. Those are cancer cells in other locations. We'll call them micrometastases, whereby you know they're there, but you can't see them necessarily. The reason you can't see them is because they're too small. How do you know they're there? They might be releasing a tumor marker into the blood. The relevance is, let's say you do a surgery and you scoop out the primary tumor, the big centimeter big tumor that you saw on the CAT scan. But then when you do a blood test, you keep on getting elevated blood markers of the cancer still being present. And that would indicate the micrometastases from other locations in the body are still producing cancer cells. Now, there's 3 main types of treatments in conventional medicine. By the way, McDougall says it's virtually always metastatic by the time you can detect it. And that's if it's a rabbit, okay? And here's a paper reference, okay, Journal of Surgical Oncology. All right, so what I'm going to say now is, once you think there's going to be tumor, they're going to ask me to biopsy it. So they're going to say, when tumor is the rumor, tissue is the issue, cancer is the answer. So please obtain tissue. We want a tissue-confirmed biopsy diagnosis. All right. When you do, there's 3 main treatments in conventional cancer treatment. Number 1, there's surgery. So you go in there and you cut out this tumor. Number 2, there's radiation. So you would zap the tumor with radiation. Those are both for local control of what is called the primary tumor. The primary tumor is the one you initially diagnose. You can see it on CAT scan. It's over 1 centimeter in size. Then there's what are called secondaries, and those are the metastatic lesions. And those typically are so small you can't even see them in the beginning, okay? So stuff that's micrometastatic around the body, you can't even see it. There's only one way to treat it in conventional medicine, and that is with chemotherapy. Chemotherapy is a systemic therapy. Systemic means goes everywhere in the body. Local therapy is surgery and radiation, and that just goes to right where the tumor is. Those are the main treatments. There's other rare situations where you can use something called radiofrequency ablation, like with a liver tumor or with a cryoablation with a liver tumor, with a prostate tumor, for example, but it's rare that those things get used. Those are special situations. Okay, I just want to show you some of these biopsy needles, okay? And like I said, too, I've done thousands of these, okay? So here is what is called a fine needle aspiration. So fine needle aspiration biopsy, usually it's going to be a 25 gauge needle, sometimes a 22 gauge needle. Okay, for a core biopsy, the most common core biopsy I'll do is an 18 gauge needle. So the difference is the specimen. The specimen obtained with a fine needle is just a couple of individual cells. So we call that cytology. CYT, cyte means cell. So a fine needle aspirate is to obtain a small specimen of cells for cytology. They look under a microscope at the individual cells, and based on the individual cells, they can tell if it's cancer or not. Okay, the second type of biopsy is what is called a core biopsy. A core biopsy, you got this slotted notch on a bigger needle, and it cuts a little piece of the tumor out that looks like an inchworm, and then you put that under a microscopic slide, and you can fix it like with formaldehyde and other pathology chemicals, and you can see the benefit of histology. So histology means tissue, cytology means individual cells. Histology means a bunch of cells in their normal appearance as they occur in the body. The relevance is to diagnose some types of lymphoma, for example. You have to be able to see the relationship of the cells to each other. It's not enough to just know the cell type. You have to know the relationship to each other. You can send it for other types of testing too. Flow cytometry, a cell counter to count the relative percentages of the different types of cells in the specimen. All of that is well and good. And then they do a bunch of different stains to look for characteristic features of different types of cancers. But in terms of getting the preliminary specimen, there's fine needle aspiration, just a few cells. There's core biopsy, taking a little slot, a little inchworm-shaped specimen, and then there's surgical excisional biopsies to remove the whole tumor mass, the whole lymph node or whatever it might be. Okay, by the way, if it's pretty standard to do 2 core specimens. So if 2 cores is routine, what would you call it if a 3rd core was obtained? That's an encore. Okay, that's a joke, all right? I make little jokes when I'm doing the biopsies, especially if I got people watching me. Like if I got a medical student watching me. I'll prep the patient, typical starting in the center, going outward in a circle. And then I'll ask them, okay, where do you think I learned how to prep like that? And they'll go, well, I don't know, during your residency training? I'll say, no, I learned that in prep school. Okay, so it's just, those are biopsy jokes. Okay, so here is the way you describe a tumor. So to describe a tumor, you've got the tumor initiation. That's what begins the whole process. I can't get this thing to shrink. And there we go. And then you've got tumor promotion. That's where it starts to grow. And then you later have the late stages when it metastasizes to other locations or sometimes, invades some important local structure. So then we got to talk about the 2 main types of cancer causation. What is taught in conventional medical schools is what is called the SMT, somatic mutation theory. And that means that some chemical, typically toxic chemical, damages the DNA and that initiates cancer. Okay, that's what's in all the textbooks. Causes a mutation. But what I think is a much more common cause of cancer is what is called the MTC, the metabolic theory of cancer. The metabolic theory of cancer is what was figured out by Otto Warburg, that you get decreased oxygen delivered to the cell. That's called hypoxia. It means a lack of oxygen. And that damages the mitochondria, and the cell can no longer run on mitochondrial metabolism. Mitochondrial metabolism is using oxygen to make energy, to make ATP is the energy chemical of the cell. So you can make 18 times as much ATP with oxygen metabolism as you can with anaerobic metabolism. So when you damage that mitochondria by hypoxia, that cell is in trouble. Okay, a lot of times the cell will just die or it could become dysfunctional. But the relevance is a normal cell is typically a worker. It has a job to do. Let's say you're a liver cell. If you're a liver cell, you got responsibilities. You got to maintain blood glucose level for the brain. So you got to store glycogen, break down glycogen, run gluconeogenesis. Because that's the most important thing the liver does is maintain blood glucose levels to keep the brain functioning. Okay. The liver also detoxifies chemicals. It conjugates chemicals, making them more soluble in the bile. It's a pretty busy cell. It metabolizes foodstuffs as they come into the liver after a meal. It's the metabolic workhorse of the body. It's this giant big thing about the size of a football located in your right upper quadrant of your abdomen. Okay? So in order to do its job on a daily basis, it's a worker. And it's blue-collar worker, construction worker working its butt off, okay? It needs tons of energy. So it needs oxidative metabolism. If you damage that cell so it can't run oxidative metabolism, it's like, hey, I can't do all this work. I don't got any energy. I got 18 times less energy because I don't have oxidative metabolism. So it's like that Johnny Paycheck song, take this job and shove it. I ain't working here no more. So the liver cell it reverts to becoming primitive like a bacteria cell. And a bacteria cell is very selfish. It ain't a worker. It don't care about the rest of the liver or anybody else. It just wants to replicate itself. So it just tries to make copies of itself. And we're going to come back to that in just a little bit. Well, the important thing to realize is you can't change initiation. That happened, who knows, years ago. But tumor promotion, you can affect this in a big way. you can avoid all the things that increase tumor promotion, like animal protein, so you don't want to eat any meat, estrogenic chemicals if it's an estrogen-sensitive tumor, excessive iron that can activate mTOR, the mammalian target of rapamycin, the nutrient-sensing pathway, which when fulfilled tells the cell to grow. So mTOR is like a building contractor, and it's waiting to have the building materials before it can build, let's say, another house. So you want to deprive mTOR of what it needs to make a copy of itself. Because for a cell to make a copy of itself, it has to replicate itself. It has to make a copy of all its proteins, all its lipids, okay? So by depriving it of what it needs to replicate, you can prevent that cancer from growing. So it likes insulin-like growth factor. It likes high insulin levels from high-fat diets. It likes the amino acids that come from animal protein. It likes the immune system turned off. Immune system suppressed, and there's ways to do that, like with high salt diets will suppress the immune system, high fat diets suppress the immune system, okay? All right, so now we'll talk about some of the additional features of cancer. One thing I want to briefly mention is cancer screening. So imagine you're walking down the pathway in a shopping mall. There's like a sidewalk shopping mall, and you're walking down, and then there's stores on both sides of you, and there's a couple men on the roof, and they got this giant net, and they throw the net down on top of you. That's what cancer screening is. They caught you. Now I got you, you chumps. You previously were citizens, free and healthy. Now you're cancer patients, and we're going to start making some money off it. Okay. I've been involved in cancer screening for over 30 years, and I can tell you it's a risky business because most of the patients have nothing or they got turtles, but it's hard to tell that at first. All right, so now you got to learn about turtles, rabbits, and vultures. So imagine that you are a farmer and you own a giant farm, 100 square miles, and the perimeter has a big fence all around the perimeter. In the center is an enclosed areas, and you got 3 types of animals. You got turtles, you got rabbits, and you got vultures. All right. So imagine somebody left the door open on one of these enclosures in the center, and the turtle got out and starts walking to the perimeter fence. You could go on vacation for 1 year. You could take a 2-year sabbatical, and you could come back, and the turtle would still not have reached the fence. The turtle's so slow. Once the animal gets past the fence, patient dies. Okay, so what I'm trying to say is, no matter what you do, the turtle ain't going to kill you. You're going to die of something else. All right. Now, the other type of cancer is a vulture. Now, the vulture would be, let's say, in the enclosure in the center, and let's say somebody left the window open in the central enclosure. The vulture is going to go out that window, and it's going to fly. And it's going to fly over that perimeter fence within a couple hours. Patient's dead. There's nothing you could do. Even if you screen, the cancer vulture will arise in the interval and kill the patient before you can do anything. The only thing about vultures is vultures are so rare. You'll see just a couple in your entire career if you work with cancer all the time. That for our intents and purposes, vultures don't exist. They're so rare that for our purposes, they don't exist. Okay, now what I want to talk to you about is a rabbit. Now, a rabbit is what everybody thinks a cancer is. Everybody thinks that all cancers are rabbits, but they're not. As a matter of fact, most cancers are turtles. But a rabbit, let's say the rabbit digs a little hole underneath the central fence, and it makes a run for that perimeter fence. You go, we must stop the rabbit. Get it with surgery. Get it with radiation. Hit it with chemo. We got to stop that rabbit. All right. So that's how conventional medicine works. They're always worried that everything's a rabbit. And a lot of times in the beginning, you can't tell if it's a turtle or a rabbit. That's one of the dangers of screening. In the beginning, when you diagnose a cancer, a lot of times you don't know, is that a rabbit or a turtle? And the tendency is to treat it aggressively in case it is a rabbit. But now you run into a problem. You had a turtle cancer, which never would have killed you, but you don't know if it's a turtle or a rabbit, so you treat it as a rabbit, and now you're giving the patient powerful chemotherapy or doing a big surgery. The patient might die from the chemo or from the big surgery because you don't know if it's a turtle or it's a rabbit. So you see, there's a danger in the screening. You know, after 30 years of experience with them, I won't go. What I do is I make myself as healthy as I can possibly be, so my odds are better just by making myself healthy than they would if I went through the screening process, because you can get false positives. Again, false positive is where you think it's where it's not cancer or it's a turtle, but you think it's a rabbit, so you overtreat it because you don't know. All right. You also get a lot of incidental-omas, meaning little nodules that might just be scar tissue, but you can't tell initially if they're cancer or not, that sometimes need years and years of follow-up or get biopsied and stuff. And you'd rather not have to go through that if you could avoid it. Here's Otto Warburg, German biochemist. Otto won the Nobel Prize in 1931, figured out the Warburg effect, Hypoxia induces mitochondrial damage, and then the cell runs on anaerobic glycolysis. So they'll call it aerobic glycolysis, but the cell runs on glycolysis, meaning that it's just making 2 ATP for each glucose molecule instead of like about 34. And it's a big problem for the cell. That'll push the cell towards becoming a cancer cell. This is Michael Brownlee. He's a genius who figured out that high-fat diets cause type 2 diabetes. Sat fat is the worst one. It'll end up causing overnutrition that'll inhibit the intermitochondrial matrix electron transport. Okay, so high-fat diets are bad for mitochondria. That's an important thing to know. And when you block this mitochondrial function, you increase the risk of getting cancer, and it's even worse than what I'm telling you. Here's why it's worse. There's something called the flip-flop maneuver, meaning the more fat you eat, the more fat flip-flops into the cell cytoplasm. They tried blocking all the fatty acid transporters. It didn't matter. The fatty acids would flip-flop from the outer leaflet of the plasma membrane to the inner leaflet of the plasma membrane. Here's a paper if you want to see it. Anthony J. James Hamilton, 2020, Putative Inhibitors of Fatty Acid Transport Across Membranes by CD36, okay? Journal of Lipid Research. So anyways, 2020. I tell you that because all you can do is reduce your dietary fat intake if you want to lower your risk of type 2 diabetes. It's a smart thing to do. It's pretty obvious. And you want to get your dietary fat intake below 10%, then you dramatically lower your risk of atherosclerosis and hypertension, which also contribute to causing atherosclerosis, which makes tissues hypoxia, which increases cancer risk. You get it? It's the best thing you do to protect yourself. And then you'd want to avoid all these mitochondrial inhibitors. I've given other lectures entirely on this subject where I found over 100 of them. Okay? So all these things damaging mitochondria might increase the risk that a cell gets stuck in anaerobic metabolism and increases its risk of becoming cancer. So just getting atherosclerosis from hypertension, diabetes, high blood lipids, hyperlipidemia, high LDL cholesterol, high total cholesterol, and all that stuff is going to cause thickening of the arterial wall and less oxygen delivered to the tissues, increased risk of a Warburg effect. Get it? So it all goes together, and all the patients have the same disease. This is a little more detail about how the process works. If the cell is hypoxic, you activate something called the HIF pathway. That's the hypoxia-inducible factor pathway. And then once that gets all activated, it's going to send messengers from the mitochondria out to the cytoplasm to transform the cell's metabolism, to switch it from oxygen metabolism to metabolism without oxygen, anaerobic metabolism, okay? And it's going to increase vascular endothelial growth factor, which is going to cause new blood vessels to grow into the area of the hypoxic tissue to give it more oxygen. But if it's a tumor, it's going to cause new blood vessels to grow in, which might permit metastatic cells to spread. Okay, and you also get succinate. Hypoxia will block succinate dehydrogenase enzyme, and then succinate, the precursor intermediate, will accumulate, and it'll diffuse out of the mitochondria. It'll activate the cell. It'll actually diffuse outside the cell, and it activates all these other cells to start switching to anaerobic metabolism to prepare for that, to make new blood vessels, etc. So you get all this, potentially precursor cancer-like stuff going on. And that's also why the metabolic cancer theory makes so much more sense. Succinate dehydrogenase is like Paul Revere running around saying, hypoxia, hypoxia, hypoxia. Prepare for anaerobic metabolism. Prepare for anaerobic metabolism. Remember, anaerobic metabolism is a precursor step to the cell becoming cancer, as if it's reverting from a oxygen metabolizing eukaryotic cell, part of a human, a team player within an organ, to becoming a selfish individual, primitive anaerobic bacteria, just replicating itself and growing like cancer. Okay. So other things happen. When you start running anaerobic glycolysis, every time you make glycolysis, you end up in the end product, a lactate. And so you have lactic acid, which becomes lactate plus a hydrogen proton. It pumps that proton into the extracellular space. So the extracellular space becomes acidic. And as a matter of fact, it pumps those protons to such an extent that the intracellular space becomes alkaline or basic. And guess what? Hypoxia, anaerobic metabolism with an alkaline cytoplasm, but an acidic extracellular matrix. Remember that the extracellular matrix is acidic. That's the most important thing. This activates cell proliferation, like a cancer phenotype. It's bad. It's what you don't want. Okay. And in a sense, like I said, You start out with a human cell that's a team player, part of an organ, running on oxygen, making lots of energy, doing its job, lots of work. And it reverts to becoming primitive, anaerobic, without oxygen, just trying to replicate itself like a bacteria. That's what cancer is. It's basically a human cell becoming like a bacteria cell. And then this was one of my diagrams explaining how all these mitochondria inhibitors contribute to it, and they do. And all these things that cause atherosclerosis contribute to it because they cause hypoxia, okay? So you can get a lot of things building towards it, okay? And you don't want mitochondria inhibitors screwing up your mitochondria any worse than the situation already is. Okay, this is a little thing showing some of the work of Thomas Seyfried. He did really good research on the metabolic theory of cancer. And what he showed is the problem was injury to the mitochondria and dysfunction of the cell. It was not due to the DNA. That's an important point. That's why the somatic mutation theory seems bogus. Somatic mutation theory also seems largely bogus because the Genome Atlas product showed they couldn't find an explainable pattern of mutations with the Genome Atlas product. Okay? I do think sometimes a toxin can cause cancer, but I think the majority of the time you want to know about metabolic theory. It makes more sense. And the wonderful thing about metabolic theory of cancer is once you understand it, there's a ton of stuff you can do to help yourself. With the somatic mutation theory, it's like chemical caused cancer in my body 10, 15, 20 years ago. There's nothing I can do about that. Versus with metabolic theory of cancer, there's lots of things you can do. Okay, now I'm going to talk about something that I call hot disease, cold disease. So hot disease, cold disease is a little bit of an Asian concept. So hot disease means acute inflammation. Acute disease with inflammation, the immune system rushes in, releases all its toxic chemicals. It's painful, it's swollen, okay? And it's hot, and it hurts quite often. All right. Then as the infection is cleared, you get all these scar tissue. So I'm showing you like in a liver. Here's a liver that initially starts out with normal liver, then non-alcoholic fatty liver, non-alcoholic steatohepatitis with inflammation. The inflammation gets replaced by fibrosis. Fibrosis in the liver is called cirrhosis. And then the cirrhosis is scar tissue and increased collagen being laid down around the cells. And that's going to cause increased distance between the capillary and the tissue. So less oxygen is going to get to that tissue. So the hot disease is the acute process. The cold disease is the resultant fibrosis, the healing, the scar tissue, which makes cells hypoxic and can cause cancer in them. So you get it? So that's how the inflammation can lead to hypoxia, lead to cancer. And this can happen anywhere in the body. In particular, we think of it in the liver, the digestive tract. Here's just one more example to make clear that idea of hot disease, cold disease, cancer. So somebody swallows asbestos fibers. The asbestos fibers are inhaled into the lung. The lung forms an acute hot inflammatory response to them. You might have a pleural effusion, fluid accumulating in the chest, and then it walls it all off, the asbestos fiber, and some normal lung cells get trapped inside. There's some normal pleural cells, especially pleural cells. That's the lining around the lungs. Okay, well, some of those, when they're hypoxic and injures the mitochondria, they can turn into cancer. The specific name for that tumor is a mesothelioma. But the important point was hot disease, inflammation, cold disease, fibrosis, leading to scarring, causing increased distance between the artery, capillary, and the tissue, causing hypoxia because less oxygen can get to it, causing Warburg effect, mitochondrial injury, cell changing from oxidative metabolism with oxygen to anaerobic metabolism, changing its behavior then to just replicating like a bacteria, out of control, cancer, kill the patient. Okay, so what do you learn from all this? You don't want hypoxia of your cells. How do you avoid hypoxia of your cells? Low fat, low sodium, vegan diet with no oil. Okay, it's obvious once you understand what's going on. Okay, another concept, old people getting some of these lymphoid tumors. Here's a lady by the name of Maria Mittelbrun, and she gave a very nice lecture over Global Immunotalks on how the immune system functions and how this relates to cancer and healing. And basically, a immune cell most of the time sits on its butt just waiting for something to do. All right? And then when it's exposed to an infection or a tumor that it can react to, it gets activated to do a job. Let's just talk about an immune cell going into a big wound. Let's say a person, had trauma to their leg, there's a big cut and it takes time to heal, a big wound. The immune cells, they dive into the fray and they've got to try to heal it, okay? Once they're deep into the wound, there's going to be all this inflammation, all this edema, that means fluid, and they're going to be far from the capillaries. So they don't have oxygen. They have to run on anaerobic metabolism. Okay, well, that's important. Once the wound is all healed, they're like, yes, job well done. It's Miller time. Let's go for a beer. And now they can kind of go back to their old areas and they can get plenty of oxygen. So what should happen is they should shut off the anaerobic metabolism that they needed when they were like a firefighter in the middle of the fire with a lack of oxygen. And now they're coming out of it and they want to go back to aerobic metabolism. The reason is, while they're in anaerobic phase of metabolism, they themselves are releasing all these toxic chemicals. That's part of the healing process, sometimes toxic chemicals to kill bacteria. So they're stirring up inflammation. So they need to be able to turn off. Okay? But if the mitochondria are injured and they're not functioning correctly, they can't go back to mitochondrial oxidative metabolism, and they can stay in the pro-inflammatory phase where they're releasing toxic chemicals. And that's why you hear this expression, inflammation of aging, where a lot of older people have dysfunctional mitochondria and they can't turn off their immune cells, so they keep releasing toxic chemicals unnecessarily. It's almost like an autoimmune disease, and this will cause them chronic problems and accelerated aging. So you want good mitochondrial function, okay? But I wanted you to get this point. Okay, so here's what a protein is like. It's like a string of beads on a necklace. Those are the individual amino acids. A protein is just a string of amino acids, all right? And the amino acids in meat, they've got more methionine and more leucine. These tend to be the rate-limiting steps for activation of mTOR. mTOR, remember, was a nutrient-sensing pathway that is like a building contractor. The building contractor needs all his materials before he can build the building. Well, mTOR is waiting to make the cell replicate. It can't replicate the cell unless it has what it needs, which includes a lot of leucine and a lot of methionine. A lot more leucine and methionine in meat. So that's why you don't want to eat any animal foods if you're trying to avoid cancer or you got cancer. And increased iron will also contribute to activating mTOR. All right. And T. Colin Campbell found you could pretty much, speed up cancer growth or slow it down a lot just by avoiding any animal protein. Okay, so another point I want to make is if you look at somatic mutation theory, it just tells you everything's based on luck. You either were exposed to a toxin in the past or you weren't, or you got a genetic vulnerability or you don't, and there's nothing you could do about it, and you can't change your age. Okay, so you can't change any of that stuff. Okay, but things that you can partially control, you can try to sleep better, you can try to lower your stress level, you can be more careful about your diet to minimize food toxins. You can get an air filter for your house. You can avoid EMF. You can get your sunshine, spend time with friends, family, get your exercise, all those things to help you. And then there's other variables you can totally control. You can totally control, again, how much you exercise, complete avoidance of these bad things like processed food, tobacco, alcohol, Mary Jane, MJ, you know what that is. Okay, mitochondrial inhibitors. Avoid unnecessary personal care products. They're always full of toxic chemicals. Do the things that are good for you, filter your drinking water, get your exercise. Exercise improves immune function because it pumps the lymphatics to get your immune cells moving all over your body. They work by Braille. They feel chemicals, and they always ask themselves the question, self or non-self? Non-self would be like an infecting cell, or it'll be like a cancer cell. A cancer cell is a CAMPS, cancer-associated molecular pattern. Okay, a bacteria would be, or they often call it microbial, MAMP. MAMP is a microbial-associated molecular pattern. The immune cell has receptors for those, pattern recognition receptors, PRRs, that bind them and can tell if something's non-self, and then it activates a process to remove it from the body. Okay, you can avoid all the excess estrogenics, etc. You can avoid other toxic chemicals. We're not going to get into all that right now. I've given entire lectures on that before. But that's basically what you can do to minimize your risk of the cancer progressing. And, it's a Spartan vegan diet, which is basically like the McDougall diet, the Nelson diet, the Esselstyn diet. You eat primarily starches, like potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. Eat fruits, especially berries tend to be pretty good amongst the fruits. Other fruits are good too. Veggies. You'll end up needing to take a vitamin B12. Do all the healthy stuff, get your sleep, get some sunshine, be religious. All the major religions make people healthier. Manage your stress, etc. So that's what you can do to dramatically lower your risk. And one of the points I'd like to make is This optimizes tissue oxygenation. You want to lower your stress level because elevated stress elevates cortisol, which suppresses your immune system. What is it that removes the micrometastatic disease? It's your immune system. Everybody's got cancer cells in their body. Once you get to be a centimeter in size, you're going to be shedding over 1 million cancer cells every day in your blood. The immune system removes them. So what I'm trying to say is under normal conditions, the immune system basically does what chemo does. It is the immune system that travels all over the body and removes that micrometastatic disease. So you want to keep your immune system as healthy as possible. How do you keep your immune system healthy? You lower your stress level. You get your sleep. You avoid caffeine. You exercise, which pumps your immune cells to move all over your body. I actually think staying warm is beneficial as well. Sunshine is beneficial as well. All of that optimizes immune function. Then you have to avoid the bad things. Avoid fat. It suppresses your immune system. Avoid things that make your blood acidic, okay, which means animal protein. What else? Avoid sodium chloride because that causes a little bit of a displacement of the blood buffer bicarbonate, the negative ions, anions like the chloride in excess. So you want to avoid that, all right? All of that will optimize your immune function, and then the immune system can travel around the body and remove those cells, give you the best chance of long-term survival, okay? So that was a key point. So what I'm trying to say is what chemotherapy does is what your immune system does. But your immune system is always there 24/7, 365 days a year. Chemo is only a brief time, and chemo's got a lot more toxicity. Whereas a good functioning immune system, there's no toxicity, and there's a lot of benefit. So anyways, that's an overview of cancer, an introduction. I hope you found that helpful.